What if I told you that one of the greatest threats to your heart after the age of 60 might not be the food on your plate or the number on your blood pressure monitor, but the very medications you trust every single day? It sounds unbelievable, yet it's a conversation that deserves far more attention than it usually gets. The truth is, many medications save lives and remain essential for millions of people. But every medication also comes with trade-offs, especially as we grow older. The problem isn't necessarily the medicine itself. It's when those trade-offs are never discussed. I'm Dr. Ethan Cole, a cardiologist with more than 15 years of experience helping patients protect their hearts and improve their quality of life. Throughout my career, I've seen countless people doing everything they believed was right, taking their medications faithfully, eating healthier, exercising when they could. Yet they still felt exhausted, weak, or noticed their heart health gradually declining. In many cases, the answer wasn't that their medications were bad. It was that nobody had taken the time to look at the complete picture. As we age, our bodies process medications differently. The kidneys filter more slowly. The liver breaks down drugs less efficiently. Several medications that work well on their own can begin interacting in unexpected ways when they're combined. That's why today's video isn't about telling you to stop taking your prescriptions. Never stop a prescribed medication without speaking to your healthcare provider first. Instead, this video is about helping you ask better questions and become a more informed partner in your own care. Today, we're counting down 5 popular medications that deserve a closer conversation with your doctor after the age of 60. Some may surprise you. And the medication at number 1 is often taken with the best intentions. Yet many people have never heard about one important consideration that could affect long-term heart health. Before we begin, if you're someone who wants straightforward, evidence-informed health advice explained in plain English, take a second to subscribe to the channel. And if you know someone over 60, a parent, spouse, sibling, or friend, share this video with them. One simple conversation could make a meaningful difference. Let's begin with number 5. Number 5 is proton pump inhibitors, commonly known as PPIs. These include medications such as omeprazole, pantoprazole, and similar drugs that many people take for acid reflux or chronic heartburn. For some patients, these medications are absolutely appropriate and highly effective. But when they're used continuously for months or even years without regular review, they deserve another look. Here's why. Your stomach acid isn't simply there to cause heartburn. It also plays an important role in helping your body absorb essential nutrients. When stomach acid remains suppressed for a long period, it may become harder to absorb nutrients such as vitamin B12 and magnesium. Both of these nutrients contribute to healthy nerve function, muscle performance, and the normal electrical activity that keeps your heart beating in a steady rhythm. Now, that doesn't mean everyone taking a PPI will develop a deficiency. Many never do. But after the age of 60, your body's ability to absorb certain nutrients naturally becomes less efficient. Long-term acid suppression can add another layer to that challenge. Have you ever noticed someone saying, "I'm just getting older," when they're constantly tired, struggling with balance, or experiencing muscle cramps in the middle of the night? Sometimes aging is part of the story. But sometimes there's another explanation worth investigating. Imagine someone like Margaret, a 68-year-old retired teacher. She had been taking medication for reflux for years. Gradually, she noticed increasing fatigue, occasional tingling in her feet, and muscle cramps that interrupted her sleep several nights each week. She assumed these were simply unavoidable signs of aging. During a routine medical review, her physician checked her vitamin B12 and magnesium levels. Both were lower than expected. After working with her healthcare team to address those deficiencies and reevaluate her treatment plan, she began feeling more energetic over the following months. It wasn't an overnight miracle, but it reminded everyone involved how important regular medication reviews can be. But here's the part many people never hear. Many prescriptions are started for good reasons, yet they're rarely revisited once symptoms improve. Months quietly become years. Years become decades. Meanwhile, our bodies continue changing. If you've been taking a proton pump inhibitor for an extended period, don't stop it suddenly on your own. Stopping abruptly can sometimes cause rebound acid production, making symptoms temporarily worse. Instead, ask your healthcare provider whether it's still necessary, whether the dose remains appropriate, and whether monitoring nutrients like vitamin B12 or magnesium makes sense in your particular situation. Sometimes the best medical decision isn't adding another prescription. It's simply making sure the current plan still fits the person you've become today. And that brings us to number 4. A medication found in millions of medicine cabinets that many people don't even think of as a heart medication. Yet for some older adults, it deserves far more respect than it usually gets. The surprising connection may completely change the way you look at treating everyday aches and pains. Number 4 is a medication that almost everyone recognizes because it's available in nearly every pharmacy, grocery store, and even gas station. I'm talking about non-steroidal anti-inflammatory drugs, or NSAIDs. Medications like ibuprofen and naproxen can be incredibly effective for reducing pain and inflammation. Used occasionally and as directed, they're appropriate for many people. But after the age of 60, taking them frequently or for long periods deserves a careful conversation with your doctor. Here's why. As we get older, our blood vessels naturally become less flexible, and our kidneys become more sensitive to medications. NSAIDs can affect blood flow to the kidneys and may contribute to fluid retention and increases in blood pressure in some people. For someone already living with heart disease, high blood pressure, or heart failure, those changes can place additional strain on the cardiovascular system. Think of your heart as a pump working every second of every day. If the pressure inside the pipe suddenly increases, the pump has to work harder. Over weeks or months, that extra workload can begin to matter. Now, this doesn't mean you should panic every time you take an ibuprofen after gardening or a long walk. The concern is usually regular, long-term use without ongoing medical supervision. Let me share another example. Picture Robert, a 72-year-old grandfather who loved spending weekends working in his garden. Arthritis in his knees became more painful every year, so he started taking ibuprofen almost every day just to stay active. Over time, his blood pressure slowly crept higher despite taking medication to control it. He also noticed swelling around his ankles by the evening. During a routine visit, his physician reviewed every medication he was taking. Not just his prescriptions, but the over-the-counter medicines as well. Together, they discussed alternative pain management strategies and adjusted his treatment plan. Within a few months, his blood pressure was easier to control, and the swelling had improved. That's why it's so important to remember something many people overlook. Over-the-counter doesn't automatically mean risk-free. Have you ever looked inside your medicine cabinet and thought, I've been taking this for years, so it must be completely harmless? That's exactly the assumption that deserves another look. If you're using NSAIDs regularly, ask your healthcare provider whether there may be safer options based on your medical history. Sometimes physical therapy, topical anti-inflammatory treatments, or other pain management approaches may be appropriate depending on the cause of your pain. Now let's move to number 3. This next medication surprises many people because it's prescribed every single day to protect the heart. Statins. Medications such as atorvastatin and rosuvastatin have helped reduce cardiovascular events for countless patients around the world. For people with established cardiovascular disease or certain risk factors, statins can be life-saving medications. That fact is supported by decades of clinical research. But medicine is rarely as simple as good or bad. Every medication has benefits, potential side effects, and individual considerations. Some people taking statins report muscle aches, weakness, or unusual fatigue. Others never experience these problems at all. If these symptoms develop after starting a statin, don't assume it's simply part of getting older. But don't stop the medication on your own either. Instead, have a conversation with your physician. There may be several possible explanations. Sometimes adjusting the dosage helps. Sometimes switching to a different statin improves tolerance. Occasionally, another underlying condition is responsible entirely. Here's something I tell many of my patients. Never suffer in silence because you think your symptoms are normal. Imagine Linda, a 69-year-old retired accountant. A few months after beginning cholesterol treatment, she noticed climbing stairs became unusually difficult. Her legs felt heavier than they had before, and she assumed retirement had simply made her less active. During her follow-up appointment, she mentioned these changes almost as an afterthought. That simple conversation changed everything. Her healthcare provider evaluated her symptoms, reviewed her medications, and determined that adjusting her treatment plan was appropriate. Within several weeks, she noticed significant improvement while continuing to manage her cardiovascular risk. The lesson isn't that statins are dangerous. The lesson is that communication matters. Far too many people never mention new symptoms because they don't want to bother their doctor or they're convinced nothing can be done. But here's the question I want you to remember before your next appointment. Could any of my medications be contributing to the way I've been feeling? That one sentence can open the door to an entirely different conversation. We've covered medications for heartburn, common pain relievers, and cholesterol. But the next two medications involve decisions that affect millions of older adults every single day. One helps prevent dangerous blood clots. The other is so common that many people consider it nothing more than a daily vitamin. Yet both deserve careful discussion because understanding when they're helpful and when adjustments may be needed could make a meaningful difference in protecting your heart after 60. And number one is the medication I believe every older adult should discuss with their healthcare provider at least once, because the answer isn't the same for everyone. Now we're down to number two, blood thinners. For millions of adults over 60, medications such as warfarin or newer anticoagulants have dramatically reduced the risk of stroke caused by conditions like atrial fibrillation. These medications save lives every single day, and for many people, they are absolutely essential. But here's where many patients become confused. Some people hear about possible side effects online and decide to stop taking their blood thinner on their own. That can be incredibly dangerous. The real conversation isn't whether blood thinners are good or bad. The real question is whether you're taking the medication that's most appropriate for your specific medical condition, kidney function, age, and overall health. Medicine has evolved significantly over the past decade. For some patients, newer anticoagulants may offer advantages over older medications, while for others, traditional therapies remain the safest and most effective choice. The only way to know is through an individualized discussion with your healthcare provider. Let me give you an example. Picture David, a 76-year-old retired pilot who had been taking the same blood thinner for many years. During a routine review, his cardiologist noticed changes in his kidney function and discussed whether his current medication was still the best fit. After carefully reviewing the risks and benefits, they adjusted his treatment plan to better match his current health needs. Nothing was wrong with the original prescription. His body had simply changed over time. And that's something many people forget. The medication that was perfect for you 10 years ago may deserve another review today. Not because it failed, but because you are not the same person you were a decade ago. Before we reveal number one, let me ask you something. When was the last time someone reviewed every medication, every supplement, and every vitamin you're taking? All together? Not just one prescription. Everything. Because sometimes the greatest risk isn't one medication. It's the combination. Now let's finish with number one, calcium supplements. This surprises many people because calcium has long been associated with stronger bones, especially for women after menopause. Maintaining healthy bones is incredibly important as we age. But supplementation isn't always as straightforward as many people believe. Some research has raised questions about whether high-dose calcium supplements may affect cardiovascular health in certain individuals, particularly when they're taken without considering the person's overall diet, vitamin D status, kidney health, or other medical conditions. The evidence isn't completely settled, which is exactly why this conversation belongs in your doctor's office rather than on social media. Here's what often happens. Someone hears that calcium is good for bones. They buy the largest bottle they can find. They take it every day for years. No one ever asks whether they actually need that amount. Imagine Helen, a 71-year-old grandmother who faithfully took calcium supplements every morning because she'd been told years earlier they were good for her bones. During a routine bone health evaluation, her physician reviewed her diet and discovered she was already consuming plenty of calcium through food. Together, they adjusted her nutrition plan and personalized her supplementation based on her individual needs instead of following a one-size-fits-all approach. That's the key. Personalized medicine. Not internet medicine. Not neighbor medicine. Not this worked for my friend medicine. Your health deserves better than that. As we finish today's countdown, I want you to remember something that may be even more important than the names of these medications. Medications are designed to help you. But every medication should be reviewed periodically as your body changes with age. Your kidneys change. Your liver changes. Your heart changes. Even your nutritional needs change. That's why regular medication reviews are one of the most valuable conversations you can have with your healthcare provider after the age of 60. So let's quickly recap. Number 5. Long-term proton pump inhibitors may warrant periodic review, especially regarding nutrient monitoring. Number 4. Frequent use of NSAID pain relievers can increase cardiovascular concerns in some older adults and should be discussed with your physician. Number 3. Statins remain important medications for many people, but any new muscle symptoms or unusual fatigue deserve medical attention rather than being ignored. Number 2. Blood thinners save lives, but your treatment should be reviewed regularly to ensure it still matches your current health needs. And number 1. Calcium supplementation should always be individualized based on your diet, bone health, and overall cardiovascular risk, not simply continued out of habit. Now I'd like you to do one simple thing. Before your next doctor's appointment, write down every prescription medication, every over-the-counter medicine, every vitamin, and every supplement you take. Bring that complete list with you. Then ask one question. Is every one of these still the best choice for me today? That single question could lead to one of the most valuable conversations you'll ever have about your health. If you found today's video helpful, please give it a thumbs up, subscribe to the channel, and share it with someone you love who is over the age of 60. The more informed we are, the better decisions we can make together. Thank you for spending these moments with me. Until next time, take care of your heart. It's the only one you'll ever have.